This recording has started. Welcome, everybody. Thank you for being here. Good group today. So first of all, we'll go around the room and do introductions for the recording. Curtis Landers, Lee County Sheriff.
Jenna Wallace, DA.
Adam Shank, Sheriff's Office. Carl Berger, Sheriff's Office.
City of Juvenile and Adult Probation.
Nicole Riggs, Phoenix Wellness.
Ben Metcalf, Phoenix Wellness.
Carol Buckeye, presenting judge.
Jess Ramsey, Stutz Baby Health.
Wiley Stokes, Phoenix Wellness.
Ashley Ramirez, Phoenix Wellness.
Dee Butler, Behavioral Health and Selects.
Selena Johns, let's.
Jamie Russell, Sheriff's Office.
Okay, so we'll get started.
Do you want to do that online?
Oh, I'm sorry. Yep, I got Chief Broderick. Want to introduce yourself? Guy Greco. Okay. Thank you. We're going to get started. Did you want to do an update on the?
Sure. So the since last meeting, job was posted. We've had 7, actually, I think we had 8 applicants, 7 passed the initial screening. We are interviewing them Thursday afternoon this week. Lieutenant Shanks is going to be on the interview panel. Wiley Stokes, there you are.
Yeah.
Sorry.
Sorry, I missed your email. Sorry, it's fine. I missed your email. I was out sick for a while, so but I did just get back to you.
Yeah. And then Jamel from Reconnections is going to be on the panel as well, along with Ellen Branford, who's in my office and will be the supervisor of the position. So we're set to do those Thursday afternoon. Hopefully we'll have a candidate in that group and then be able to get them hired on as soon as possible. And then we should be good to go. Great. Yeah, which is great. Months in the making, we did it.
Okay, that'll be good. And then of course that person will be here and integrated in and get caught up to speed with everything that we've done and pretty close to them. It's exciting. But the tribe, maybe I can put you on the spot and see about an update on your funding and what's happening there, if anything.
No, you know what? I just filled out a survey last week about how we wanted the money. And so I just turned it in last week. So I believe there's 3 or maybe 4 tribes opting in, but so we're just still at the beginning point.
So Selects has opted in.
Yes,
Okay, and you know the amount you're getting?
we don't know.
Oh, you don't?
It'll depend on how many tribes. We think maybe 4 tribes are opting in, but there could be 5. And that
Then
will,
we'll divide it between, okay. What's the deadline?
it was last week.
Okay, so you'll know soon how
Yeah.
many, okay,
We will know, hopefully this week.
okay.
Yeah, but we will get the money until after the 1st. I do know that.
Is it divided evenly between the
It
amount?
would be divided, it depends, it can either be divided evenly or it'll be divided, depending on our user pop, our IHS user pop. And that's what we opted for, because we are across 11 counties, we have a larger population we serve. So that's what we opted, that's what we wanted, but we won't know until they give us the results of that.
What type of services are you thinking, or, I mean, I guess our question was, is it like, do you want to coordinate with us? or-
Absolutely. And Sheriff and I have had a conversation about that. We were gonna support, but we really haven't talked about exactly what that looks like, but we're definitely gonna support the effort here. Like whatever that need is, whatever that identified need is.
So I mean, you know, the sheriffs are the ones that control the such situation, so we know it's like important to have, you know, some funding go there. And we just like, whenever I was in the meeting with them, I just asked them to send us the coordinators for all the 11 county areas that we serve. That way they have a contact with us, that they can get hold of us and offer services, and they need some culturally relevant services. And we can just coordinate and see what that looks like. I think all we're gonna need for the other counties right is like phones and I think that we'll have staff already out there to help with that.
But I know that you and I talked about it, about like what the need is here, like what are the identified, and I think back then, that was a couple months ago.
Yeah.
That was like, we were talking about the detox beds, potentially the stabilization center. And so we really don't have anything identified, I mean, like specific what we're gonna.
Well, and we don't really either. I know we put into the grant, but of course, last couple of months, we ran into some hurdles that we had to get over and challenges. And now we're kind of at that point to going back to that discussion, I think. So kind of a segue into what I was going to talk about more about our funding and where we really need to, because if we want those contracts with the detox center, we really need to start working on those. Stabilization is still in my mind, in my opinion, really the number one thing we need, because we really need a place for law enforcement to take those individuals, especially those ones in really dire need in the middle of the night. I know that, we got a quote, I guess a better way to put it, from Health and Human Services about what it would cost to make their stabilization center 24/7. It was more than what the grant money we had. Their stabilization center and what I vision a stabilization center seem to be two different things. For the qualifications of the individuals they want there 24/7. I think they can still set up theirs however they're gonna do it for their population, but I think we should try to consider an alternative for us. And I know I talked to Wiley a little bit about that and everything that was going on. I don't know if you have further thoughts on that, as far as bringing that back on the table and maybe dedicating some of that funding toward that. You're able to accommodate that?
Ashley and I, we talked about it a bit. And it could be, like you said, it could be much more basic than what the county portrayed it as like, I mean, $300,000, that's the entire grant, I think we could do it much cheaper. But no, I haven't put any work into that as far as, finding a place and all that. But I think collaboratively, we could do that, on our own with the funding that we do have, at least to get up and running. So I can put some more work into that and we can talk at meetings about it also.
Yeah, and I was gonna reach out. I know you've been gone out sick for a while. I didn't know why, but I'm not during sick for a while. So I was gonna touch base with you about that, but I think if you wanna look at that a little bit more to see what that looks like, I mean, I'm expressing my opinion, but I think if the group is open to you looking at that, I think that would be important. Again, I think that's a critical piece of this.
Wiley, what would that look like? I mean, it's been a long time since we talked about it. What would that stabilization, like, what would that look like?
Well,
What are you guys thinking?
really it would look like a place to take people who is staffed. And my thought would be staffed by mentors.
Yeah.
You
Would it be the people that were, because we're gonna be rotating, we're having to on-call people, would the on-call people just be housed there, you think?
I would think so. If it were our month or your month or some month, they would be housed there. Or, I mean, if it's on call, I mean, they're gonna be nice if you don't get any calls, So if someone could be on call also, that would be my thought, but they would need to show up at the station at 3:00.
Right, within 20 minutes or 30 minutes of the location or whatever. If you're on call, maybe you wouldn't have to be on site, but
Absolutely, yeah.
you to be in the area.
They wouldn't necessarily need to be detoxed
Right.
at all the time. It would, I would think that a lot of those you'd be able to, mitigate by them going home if they had, place to go, unless they said that they were, their use had exceeded that where they could control it for that short period of time until, mentors could.
We're talking about the higher needs.
Yeah,
The higher needs
exactly.
people, and I'm thinking that a good majority will be, maybe lower needs also. I don't, we talked about that too, Jennifer, before,
And I think that'll be up to the officers, right? Like if they see someone and they're like, oh, well, this person is in a position where he can go home, he can call in the morning, I guess. And then if not, and if it's something like associated with the trespassing, obviously that person has no right to know they would be trespassing. So everybody can take it to the stabilization center and then, whenever business hours start, we'll have start this process.
So I have a question because stabilization centers is the big language right now, like grants and stuff. So I was just wondering, for the purpose of this group, is a stabilization center primarily a place to take people, right, that are being affected? Or are we somehow checking a box in the grant that says, yes, we have a stabilization center, and this is what we're using? Just because I know that by using the word stabilization and center, that's, alluding to some of the grant language, and those are like higher sets of requirements, like what the county, the county's been trying for a few years now to get a official stabilization center, because there's certain criteria that needs to be met within the county in order to be considered that. So just for this purpose, I didn't know if, is that, are we gonna have to have some of those structures in order to fulfill that need for the grant, or is this purely like what our community needs?
Yeah, I don't,
I think, well, and I mean, that's what we, if it's outside of the county, okay, if it's something that Phoenix Wellness Center is, we're in contract with them to establish this respite or stabilization center or something. I mean, I can imagine like the liability issues and everything else that you have to discuss. I mean, there's a requirement, there's a lot for that. To have something on premises like that. I think what we were all envisioning was when law enforcement encounters that person, I mean, normally, the whole deflection thing is they would normally take them to jail. They're pretty innocent at that hour. It's a lower level misdemeanor, whatever. And so an alternative to jail would be to take them where they're gonna meet with a mentor or a peer and have that support immediately. And then try and engage them with services. Of course, it wouldn't be required. They have no, that you can't restrain them. They can walk right out the door. That's just, they free to leave.
Yeah.
But encourage them to just meet with somebody there as an alternative to take them to jail. And I agree, I don't think it needs to be staffed 24/7, because a lot of times somebody is not going to be there. But law enforcement have the option of calling somebody 24/7 to meet them at this place to try and engage the person in services. Sometimes they would need a place to stay, because like Jesse says, if they're trespassing, they don't have anywhere to go. And it would also be a place where that could occur. Now, how long they'd be allowed to stay, and if it's over 24 hours, that was the thing too, that Health and Human Services kind of explained to us as far as the level of staffing and needs if it's over 24 hours. They talked about 23 hour. And then the person could leave and then come back, but, I know there's a lot of other logistic questions for it. It sounds like a great concept, but I'm sure insurance and everything else for your agency, I'm sure it has a lot more questions about what this would look like if you're talking about space.
and we visited the Shooting County. Can you talk a little bit about that model and
Well, and I think that is what I understand of definitions. Again, I think that word means a lot of different things to different people, depending upon, your involvement. But from what I know, what Deschutes County has is a true stabilization center. They have a 23-hour time, you gotta go out the door and
Who
then,
runs it?
some are county department, or some are county employees, and some are, community partners. So it's really a joint.
Okay. Where's the space?
It is. I don't know who owns sites. I think it's a county department. I think it's a county owned building. It's not far from the jail campus.
Okay. It's a county-owned building and that's.
Pretty sure it's county-owned.
Okay, and it's staffed 24/7?
It is staffed 24/7.
And is there medical staff?
There's medical staff on site.
So mostly staffed by peers, or what are the?
They do have a lot of peers. Theirs is kind of stabilization / crisis / so they have an area where if somebody just needs to come in and take a shower,
Mhm.
they can come in a separate entrance and just take a shower, get their basic necessities met and out the door. They have a separate entrance, or if it's a law enforcement referral case, they'll bring them in a separate area. And they just basically have a room where people can sit in lounging chairs and talk with resources about what they need, and at that 23-hour time, because of the certification, you guys don't know more about that, but they do have to say bye. But they did say that some people will literally wait outside and for that hour, come back, check back in, which they've let people do that.
And is it funded through their grant?
They got, it was a different grant, they did it through their impact grant, which is the one where we funded, wages.
And I'm sure that they've had multiple, because when I visited it, that's been 7,
You know,
8 years ago. It was pre-COVID, so it's been quite a while. So I'm sure they've had multiple different funding. Just and it may be that it's operated differently now. I kind of don't think so, because I know that the jail's able to use it often. They're transitioning people from jail, need some mobile services. They can go there, get that assistance and.
I think in the most basic sense for our community, we need is law enforcement's looking for a safe place to take somebody to. Until we can connect them directly with a navigator, right? So that's just a place that we can pull them out of an environment that they're in, whether it be they're at a location, it's a bad environment, or the people they're with is a bad environment. We can take them to a safe place if they agree to it. That starts that process of connecting with a peer navigator. And it also, we know that we were able to take them someplace that they can seek those services. So how that looks on the back end for insurance and how much treatment is done directly at that location is a whole separate story. But really for us in the community, we want to have a safe place to take people to.
And maybe it's kind of a I say simple, and I know it's not simple, but changing the term from stabilization to something else.
Yeah. Because I see it, we've already established that we're going to have that contact with the individual in the field by phone initially, and I imagine there's going to be some contact with law enforcement. So whoever it is receiving that call is going to be able to evaluate that situation. And again, like Jesse said, some of those people can go home if they have that ability and stabilize there, and then meet with the navigator the next day or so. But there's going to be that group that law enforcement's going to tell you, hey, if we leave them here, they're going to continue to do whatever. So it's either jail or somewhere else. And that's where I think this really plays a significant role in getting that person on the right track initially. I think that's going to be discussed and then plan worked out at that point.
And I think if we stay on the model of what we've been talking about here, you're starting small, right? It doesn't even have to, if we're doing it just for deflection starting out, it doesn't have to be staffed 24/7. It can be as needed as long as somebody can respond if we have a client or a.
At a certain time, right?
Yeah.
They just needed the space.
we have a really good partnership with Helping Hands right now. In Lincoln City. I know it's in Lincoln City, but we have a staff member there several days a week. And they're a shelter also. So I'm just thinking it's more along those lines too. I don't know if they would be interested in providing space for that. I know that it's in Lincoln City though, so something more Newport. Yeah, he would appreciate that, I'm sure. Shorter drive, just kind of throwing things out there.
Yeah, and again, I think kind of circling back around, we have this funding now, and we did identify a generic need of stabilization center and detox, but we have the ability, if we need to revise that, we can do that. So I think this is what we're going to, what do we really want to look like? Then how much is it going to cost? Can we meet those needs? And then kind of circle back around to the tribe needing to know what that need is locally too. And then if there's a gap we need to fill, it sounds like they have that ability to do so. Again, that funding is only good till June 30th. So the good news is we're condensing those dates down and the funding stays the same. So we might as well use that as our advantage too.
Again, we have a really good partnership with Chance right now through the burn also. As far as I think they're funded for mentoring only. I don't know if they would be willing to let us use their space too. So I'm just thinking of spaces to be able to do that are existing. So.
And is there the only one in Lincoln County, the one?
Yeah.
That's
So I have some more research to do.
So next steps then,
I'm just thinking that, I think I agree, next steps would be finding a space for it and see what logistically, if this is something that Phoenix or Reconnections or somebody, one of the agencies can accommodate the space for. What the county was telling us is that they have funds for resources that they can give people in hotel rooms, right? And then I asked, is that really a safe? I mean, some of these people just, you counted that night, you would give them a hotel room for the night. I asked, if that was a safe option for somebody. And this sounds more like what we're envisioning. I mean, sometimes it is, somebody just needs could use a hotel room for a night, but, I don't know how viable that is, and if they're, which local hotels would be willing to do that. Our list would probably shrink.
They're really limited already.
Yeah.
Still one.
Yeah.
Yeah.
With the county warming shelters, I know they're temporary, but would there be something that at least interim that we could utilize space at? And I know the Newport ones right now at a church.
I think with the county, it's all liability, right? I mean, I think they're gonna tell us no. If we don't, we check all the boxes for I would think so. I think it has to be out, my personal thing, I think it would have to be outside the county.
I think it would be nice to pursue, and I don't know how everybody else feels, but Helping Hands, I mean, it is a shelter, right? So they take high risk individuals. They already have insurance to cover those liabilities. They already allow for services to be embedded. So I think I know they generally have some space. They've had some family spaces. I know that there is some ability to separate, right? There is access to like kitchens, different things and shower spacing. So it might be worth seeing if they're willing, if they're open to doing that. I mean, because they're already kind of structured for those type of like crisis and services.
So we would like to reach out on that.
I think we can do that.
We can do that. We have a really good partnership with them as far as, I mean, we're MOU'd with them.
Okay.
It's mutually beneficial for them to have us as a treatment provider in the building and, and vice versa, for us to be able to get someone into a shelter bed. So it's been good.
Okay.
But yeah, we can reach out for sure.
That makes sense.
Yeah, that'd be great.
And I think as far as our resources, like, we weren't sure if a big amount of our money was gonna go to contracts for detox beds, which is a lot. And all of the contract does is said that we have priority for those beds, right? It doesn't guarantee a bed. And so we were talking about, is that really gonna be a good use of that money? I don't know. We don't know yet, right? We don't really know until we start, like how many people would actually be taken off the streets and go directly to detox. Right. We don't know. So I think, we can talk about restructuring and right where our money is going. I mean, if the money were to be funneled to contract with Helping Hands for a space there, and I'd like to see the money go to the peers who are going to be staffing that from the different agencies. 24/7. I mean, it should go to the people providing the services. So it should go to Phoenix or the Tribe and to Reconnections, who hopefully coordinate staffing, and that money goes directly to the people who are providing the services.
I see those peers, even when it's the peers who are making contact with you or are transferring to transporting to Helping Hands.
Right.
Whether it's Phoenix rotation or Reconnections rotation or Tribe, whatever time that is. Yeah. Good work. I'll reach out. Okay.
Yeah, you guys have staff in Lincoln City. Reconnection says that like our satellite clinics up next in, so we'll all three have.
There is a family room right next to the kitchen that's currently housed by staff at Helping Hands, but I wonder if you could talk to them about, because there's a separate entrance to that, so it would be easy access, and the kitchen's, it's like right here, and then that upstairs kitchen is right there. So it wouldn't have other contact with the rest of the building per se, like in the middle of the night or something, you would come in that separate access. And I wouldn't anticipate having more than 4 people in overnight, you know what I mean, ever. And that room specifically housed. It has its own bathroom.
So if it would work, it would be a great thing to try, right? And then we can present it to the county maybe as an option.
I think it would be better,
That's working.
I think it would be better to do that than, other than to have priority beds at detox, because I kind of feel like we already do have priority at detox. Like, I mean, I don't know about you, like when I call, you know, they get me really quick, so
Yeah.
I don't know that paying them for a priority bed with, yeah.
Maybe not now, they're on the call.
We don't.
Just kidding.
But I mean, I'm just thinking like, I don't know how we live that.
Well, and chances are the person we're encountering will likely need detox, but not need immediate detox. A lot of them are gonna be under the influence, so they're gonna have hours before detox is actually hitting, right? And so
So as long as
if we can get through the night and into early morning, then we have a lot more options, regardless of what day of the week it is. I think most out of counties are open Saturday and Sunday.
just having that navigator, like get them connected to OHP.
Immediately.
Yeah.
So that we have immediate access.
That seems to make more sense, because again, I know we were talking about that early, but it's a lot of money to really just have priority for a few beds. When I think the need is really what,
Stabilizing, yeah.
whatever we want to call it, stabilization or.
Housing.
Respite, any immediate peer support.
Yeah.
Immediate peer support, to get that started.
Yeah.
I do like respite, I like the respite better than
Stabilization.
maybe, lower requirement, but I don't know, it just sounds like a low requirement.
Yeah.
Respite rather than stabilization.
And we could still use some money, I mean, for temporary housing, like hotels and stuff like that, right? Once they are.
And we have actually.
Stay stable, but
Yeah, that in the grant too, so we can use that.
Okay, for housing and phones and that kind of thing, somebody would need.
And helping hands, if you pay them a certain amount a month, they'll guarantee beds, correct?
I believe they will contract, is PMP contracted with them? Currently, I think so.
Why are you asking?
I know, I know.
Why you
Yeah. We are contracted with them because we provide a service that's usually beneficial for both of us. So it's been a good partnership. So we haven't had to actually contract, but I think they would be open to that. I'll definitely reach out to Alan.
Because a hotel room can cost, $200, depending on the time of the year.
Sure.
It can be $200-300 a night, whereas I think they're, and I could be wrong, it was like $250 a month. So that would be, and it could be more now, but I mean, they feed them, they offer them services, they get them into treatment, they get them, into housing options and stuff if they're at that level of need. So it just seems like that would be
I think that's more influential
advantageous.
to get somebody to engage, right? If I if you gave me a hotel for the night, I'm not gonna come see you.
Oh.
Oh, you're not. Let's not, let's be honest. That probably won't happen.
No, it's not, I mean, they're immediately getting services.
Well, right, and of course, we're like, yeah, deflect me because the community's gonna know you're gonna get a hotel room for the night,
Yeah.
so.
Yeah.
Yeah.
That sounds good. So if you guys want to start those discussions?
Yeah.
If you need me, let me know, or anybody else.
Definitely, yeah, I'll reach out to Alan, and let you know right away if he's open to it, and, yeah, we can get him in, we can talk to him, that's a big.
Should just add whoever to the team.
I think we can wait to see what that initial response, if they're not interested at all, probably don't need them on the
Yeah,
group, but later we may say.
yeah, definitely.
So when we get all the pieces in order, then we get our coordinator started. When are we looking? Start.
Technically, we're supposed to start by when?
December 31st.
We don't have to- we don't necessarily have to have like a leader's clients, but we have to be up and running.
I think we should work on, with or without a place. Okay, we need to work on being able to present something in the form of, one of the commissioners or something that on the flow chart.
Yes.
Okay, that we can at least, so, and law enforcement's gonna need direction on what you're gonna do when the function program is effective. what that process looks like. You encounter somebody, you're gonna charge them with, you could charge them with, a drug enforcement misdemeanor. What do you do? What are my options? And we need something very step by step by long before December 31st, which is not that far away. So I think that's the piece that we need to start working on with or without a place. That we're gonna have people identified that are gonna be that immediate support for that person.
I agree. I think we need to engage. I actually have a citation or referral that we had worked on,
Right.
brought up. We need to get that flow chart or whatever it looks established so that we can go over that. I think we just need to get it created.
Yeah.
So I think we got enough discussions that we can draft something. I also know talking to Vet and all this, they've got a ton of documents that he's actually crafted that we can get to. That if we want to make them appropriate to our county, we can.
Not Washington.
Yeah. So
Are they including juvenile?
I don't know. I didn't talk, are we or they?
No, I mean, because that's, I know I missed some of the meetings, but.
Came up one time, I don't remember.
I think I brought it up.
Did you?
But I know that, I mean, with juveniles, it's rare, I mean, for them to obtain a misdemeanor drug charge outside of marijuana. I mean, I haven't seen one yet. So I just think, and I know that Wiley, so there's a detox center for juveniles in Grand Valley, would be a trip. But I'm just wondering if that's been thought of yet, but you know.
I don't think we've decided to include juveniles
Okay.
at this point.
We gotta start small, so we're probably,
Thanks, Doug.
we gotta start. We gotta- And then I'm sure we'll build on it as it goes. I'm sure we'll build on it as it goes. Yeah.
You can still come to the meetings.
Yeah.
I'm not gonna ban you.
Volunteer status.
So that's, I was kind of, we need to really get the meeting back on track.
Yeah.
And I think that was really what I accomplished today, and get an update and get that coordinator in here. But I think we're on the citation. Is that what we decided we wanted for officers to be able to have as something to give?
Yeah.
Yes.
Tangible, yeah.
Okay. So I remember we took some notes on the revisions, but quite honestly, I don't think with everything that was going on, we got those in there for us to provide that, just from what I'm seeing. So
If you look at the August 20th notes, it just says, review deflection citation, change title to deflection citation and remove referral.
Okay.
Suggested for the suicide prevention hotline on the back. Those are from August 20th.
so I don't have the update. We saw referral on here, so I don't think we made that update.
I think the design of the citation would be something that would be more, easier for the coordinator to track, right? So they have something they can turn into the coordinator.
So then we know that's a deflection
Mhm.
piece of it.
Right. So I think that, so just, I'm a to-do list person, so we, the deflection citation, the flow chart. I think from the partners, so like from the tribe and from Phoenix and from, Reconnections, we need to know before we present this, if there is, are you gonna coordinate amongst yourselves for a peer that is gonna be sort of on call? Because that's what I think we need to know. To present that to law enforcement.
I think for us, we had discussed like internally, we'll have a system for different people that are on call, but we would like, it'll be a universal number regardless, like, and whether that, like Phoenix will have a universal crisis number for you to call, like that person will be our on-call person.
Yeah.
And I just did with that internally.
Internally.
Okay,
I don't know if that's what Reconnections is hoping to do.
is that a research that tribe would be willing to develop too? I mean, because I'm thinking like it should be coordinated between the three, right?
I think.
Or just have somebody that if they encounter somebody that's tribal, that
Yeah.
there was somebody that they could call if somebody would be available
Yes.
to respond. Is that okay?
As that rotates, definitely one number
Right.
would be
Yeah. then you have number.
Law enforcement just calls a number and might
Not-
connect the
not-
drive, it might
not-
not reconnection.
Yeah,
Yeah,
But they don't have to think, okay, this is the second week, so now.
right.
yeah.
Just whatever the number is on.
How do you do that without
I don't think
traveling?
you can do that with different.
Yeah.
Yeah, you have to have a.
I was gonna say, yeah.
Is there a way to link?
What could we forward the number?
Oh, a number, yeah.
Whatever the number is, if we had a number, I mean, I think we can build that in with technology that,
Yeah.
It would forward to.
yeah, somebody's gonna have to
Yeah.
change that.
Yes,
But what, the number should be the same, and then wherever it goes after that, it's going to, that'll be in the back end. Yeah.
oh, by the way,
Don't change the job description now.
Sorry.
Because if you-
Isn't that how other
Doesn't
duties
matter,
are?
yeah.
I feel like I'm being involved.
Yeah, because if you change that number, then it's gonna, gonna be, it's gonna go to the wrong person at the same
Yeah,
time.
and then we'll be.
It'll get mixed up. One number is gonna be, so it's however we can accomplish that with technology would be better.
That should.
No, I mean, CASA and Carrie's do it all the
Yeah.
time. for
So it's
us.
also, yes, it's.
Yeah.
And if whoever has it doesn't forward the number to somebody else, then that's on them. They're gonna get it.
What if there's a way to set it in a system that it automatically
Oh, it automatically
does it by date?
Well, that's even, so I knew there was
Yeah.
technology.
Oh, was your question altogether, like three coordinating the phone line, not just one individual treatment center? You're gonna have it this week, you're gonna have it this week, and Reconnections is gonna have it 1 week, like one person coordinating.
I don't think, I don't see that we should micromanage that. I mean, we kind of have an informal agreement between Phoenix and Reconnections and the tribe that they're all going to provide peer supports for the deflection program. And so hoping your agencies
I
would
think
meet
we need a sub meeting
to
to
the
retreat.
Yeah.
about how that would actually look.
Yeah. Want to.
Agencies together.
Yeah.
Right,
I really don't think we get involved in that. I mean,
as long as we have an agreement.
as long as we have agreement.
If you just want a phone number.
We want a phone number.
Connect with somebody.
Right.
I think it's a good idea though, Ash, a sub-meeting treatment providers so that we can talk about what that's gonna. look
And we
like.
can build that into our flow chart, right? So the officer knows he's gonna contact this person, he's gonna fill out his citation. And he's going to call this number, and this is what's gonna happen after he calls that number. And we could write into our flow chart, maybe in broken lines or whatever, that we're gonna have the stabilization center, respite center, whatever. That he, the officer in the field would determine if that's where the person would be taken.
Wiley, did you say that there's an industry standard assessment that all three providers will use?
We'll all use ASAMs. Yeah.
Okay.
And we talked about it in our previous meeting, they don't have any notes from that about how soon that's gonna happen, right? From that first contact, I remember those from some of my notes before.
I was within
48 hours?
48 hours.
Yeah.
That's something, I guess, that we could get a copy of that to like add to
Not necessarily,
our computer.
yeah, I mean, really it would be more of us talking to the deflection coordinator
Yeah.
and to their progress. Are they intending, a lot of,
But we could send them a formal document, like that could be reflected on the books. I mean, that's pretty standard. I think like the status report is pretty standard of people's engagement and stuff. That's.
I think it's probably better to keep that information separate from the coordinator, but just maybe create a document, the coordinator could do that. Setting up, ASAM completed and give us a date.
Yeah.
Right, but that document actually never leaves a treatment agency, because the type of information that connected. in.
Yeah,
it's super in-depth.
Yeah.
That's what I was more so asking. You have an example of it, so we know what kind of questions to ask. Not have access to the actual completed exams.
It's a good hour and a half process.
Is it?
It's 6 dimensions, so it's a lot.
It's pretty
It's a lot.
intensive.
It's super in-depth, yeah.
Okay.
And that's why that usually never leaves the treatment agency, I mean, we want to preserve the relationship with the client.
For sure.
And Wendy, you had mentioned one time, and I might have misunderstood you, but is there a way that like the coordinator could have limited access to or system where they could then go
I
in.
love that Ashley Rivers is here today.
Yes, there is. There's some like limited, it just really depends on like kind of what you guys are looking for.
Yeah.
We can also tailor make documents to be like viewable for you guys. Like I could say like parole and probation right now has access to like 30-day status reports and drug testing, right? And any release that applies to them or law enforcement, they can see those documents. So we've tailor accessed it. So this navigator could have a login, right, to be able to check in like, okay, like was the assessment completed? And it'll show right there, right? So if it's, you know, in the daytime operations and she's, you know, getting the front desk and maybe there's not an ROI, but we know that it's all linked, you know, legitimately to the referral. She can look or they can look in there and see that, you know, what is completed. So yeah, there is an ability to do that.
Because that would save you guys from having to kind of create a document, just saying that assessment's done, or, yeah, or maybe I'm
Each
shocked.
individual person, yeah.
Right.
So I know reconnections also do this for live track.
Oh, okay.
So we
It would be easier for us to have like a status report.
For you to give a report.
Because you won't be able to get into our city.
Okay.
I think we should have that for live tracks.
Like, here's how I read my.
Yeah, we're just
Yeah,
trying to make it
and we're
easy
used to
for you
that.
guys.
We're used to those forms, the
Okay.
status forms
Yeah.
that we have to do for other agencies.
Like a English report, right?
Yeah, exactly.
He says that because we all three used the same system for a while. They're on a different system now. So it would have been super easy in that way. Like,
If the flexi coordinators.
you know, knew how to.
He and arm wrestle.
So this is all pieces like I'm envisioning a part of our flow chart, right? You know, this is what the law enforcement is gonna do, and this is what's gonna happen after that contact, right? And we talked about the UAs and the 30 days will be successful, so we need to drill down. I think that our big priority is drill that down into the document right now.
Our team will work on that and start drafting and get something on paper, so they can start working on it. So,
Right, cause like, what would we do if, say, Monday, Wednesday, Friday, they were almost done with their 30 days UAs and then they were sick or like something came up and they missed one of the UAs, would that be start all the way over from day one?
I think what we were talking about is that, and it's really gonna be at the discretion of the treatment provider, right? So, you know, it's like this person's doing great, they have legitimate, and then you call the coordinator and say, this is where this person's at, they just need some more time.
I mean, there's a big difference because they missed the last one because they were sick or they had contact with law enforcement because they were using each other. So,
And did they make it up? Did they call like UA the very next day, kind of like we do for help?
Yeah, exactly.
Yeah.
Yeah, that's what we talked about before is, you know, being able to advocate for how well people.
Because really, we were talking about keeping the definition, right, is, like meaningful engagement, right? And what does that look like? It could take longer. And that's, I think, what's built into the programs to be able to be flexible.
Do we have a list of stuff that deflection coordinators would track, like she's tracking, right, like that somebody's completed like the 30 days of meaningful engagement, they're tracking that an ASIM has been done within 48 hours, do we have a list of whatever else?
I think that some of our prior notes we do.
yeah, we could probably,
From prior meetings.
Okay. That should be details.
Yeah.
even if you look at the, like, job description in there too, which I think outlines a lot of stuff. A lot of the data that's required for the grant is in there. Okay, so we got, do list. Who are going to contact?
Helping hands, yes.
Highlight. I'll read everything.
Phoenix Wellness to reach out to Helping Hands to discuss a partnership for deflection purposes. Citation, I don't have who is going to work on that.
We
That's
can-
our office.
We have, we have.
Flow chart, LCSO to take lead on that, a rotation, on-call schedule for peer response. Subcommittee meeting for treatment providers to discuss a proposed plan or schedule. A crisis.
That crisis number would be an internal number, correct? That would be just something law enforcement would have.
Right. individual would call it.
Right, just making sure we're not like,
Yeah.
thinking all the same.
Each has a-
So,
More of a law
Personal
enforcement.
Right.
yeah.
Anything else then on our to-do list?
Dave, is there anything else you can think of law enforcement's gonna need?
Sounds like everything's covered to me. Just gotta get some work done. I need to
I've been a
come
little
to
busy.
meetings in person. It's really hard to hear you guys on the Zoom thing, so I'll try to get there the next few. I'm usually backed up on meetings Mondays and Tuesdays, but I'll try to make a point to schedule some time.
I do think, and I don't know if this is feasible from a time standpoint, but what I would love to do is be able to go to the different law enforcement agencies, maybe with a treatment provider and myself, and be able to talk to the officers and kind of, in a sense, pitch this program and explain the process and answer any
I
questions.
think that would be necessary.
Yeah.
That's what I envisioned
Yeah.
early on, to have some type of training where
Yeah.
we're gonna go there, briefing trainings, because it wouldn't take very.
And answer questions.
It gives them buy-in, like they're part of the program. It's really, they're the most important part.
Exactly.
It's like they need to feel like they're part of this. This isn't just another task that they have to do, like this is.
Something to be hoping for.
Yeah, they get some buy-in. Lane County said that they did that, like, once they did, like, their officers, it changed, like, their attitude, stuff, except first they're like, oh, wait, what do we gotta do now? And then they're like, yeah, this is what we're trying to do, this is what we're trying to accomplish. You guys are really important, and then they're like, okay, and then call them, like, so what about this? They like just really have a little buy-in, and it really changed.
Plus, you're gonna get a lot more consistent approach to it.
Yeah, well, they said that they did all that, and they went through everything, and then still one of the first deflections that they got was for a reckless driving.
I'm gonna apologize right now, you're not, it's not gonna get.
So maybe I will work with the chiefs and figure out maybe scheduling something mid-December would be my best guess. And so that we can maybe set up a time, and I don't know if we can talk too about maybe doing like centralized trainings versus going to every agency on a shift change, but I think that that's really important.
To answer questions.
And answer questions, yeah. And my hope is that we have the flow chart done by then, because that would be a really great time to.
Should we maybe have the peers with us too, since they're gonna be the ones
Yeah.
working together?
That would be great, yeah,
Yeah, so maybe we do more than just a briefing,
yeah,
but we, you know,
Maybe
the
have
city's got a
some
great training. room.
Yeah.
We can schedule someone there and then down here and just get everybody through.
I was gonna say, yeah, and I think if agencies could make it a mandatory training, then that would be helpful.
Yep.
Okay, I will work on getting that scheduled then. I can work with the sheriff on that. Is that okay? Then you went.
Do whatever you want to get rid of.
Okay, I will work on that then.
Yay. Progress. I'm feeling good.
Okay, sounds good. Awesome. Next meeting then. We have a lot to do. What are we thinking of process?
Do you think the flow chart would be in some type of form by next week, or do you think that's optimistic with it being Tuesday?
So I'm gonna help you with it. It's out till Thursday. I can try. Next Tuesday.
The other option, we can do the Monday before Thanksgiving. That's 2 weeks. Does anyone have a preference?
I would say the Monday before Thanksgiving.
Yeah, the tribe is off on the 18th.
Yes.
25th.
We're done.
That would actually.
On the schedule.
Let's do it.
Looks like it's good for everybody here.
25th.
Chief, good with you?
Monday the 25th, so, okay.
Monday the 25th then, and we'll be a lot to hopefully.
Yeah, because we love the position.
Hopefully, yeah. I don't know if they'll be started by then, but
Maybe ready to bring
they should
it.
have a start date by then.
At least ready to go.
Yeah, definitely. That would be awesome.
And Wiley, so you could just email and just say like that's even an option.
Yeah, I texted him.
Okay.
Alan, that's not. Helping Hands,
Probably had it.
Portland area, you know, they took over the old walk coach.
Yes, okay.
Huge up there.
Yes.
Hill, they're hosting on it.
Does that normally, that's on the first night today. I just need the question, so like. So just gonna add, whoever you want there, so you can do that.
Yes, who does? Okay, already done, already.
Yeah.
Wiley, are you free Friday, the 22nd? We're gonna pick that.
You gonna be there?
Huh?
Is Dee gonna be there?
Yeah.
Thanks, everyone. Yeah, I
Probably
guess.
try to, treatment meeting.
What? A
We
provider
should
meeting?
probably have a provider meeting.